I'm delighted to be here as always. There's something about stages and IFSES that warms this old heart, and it's great to be here, even if we are at the tail end. When I was presented with this title, what is the role of international surgical societies in education, it seemed rather dry to me, but I must say that it gave me reason to reflect upon what we were doing over the last 4 decades, the first 2 decades being flexible endoscopy, and the last 2 decades focused upon laparoscopy. I realized that all that history was as important as what is happening today. Everyone would agree that the role of the international societies is to provide a framework for interaction, communication among the surgeons. And we could list a long menu of points for discussion, but I'd bore you to tears if I were to talk about these points, because what's really relevant is what's going on now in 2010. And in answer to that question of what is going on now, I have one single point to make in this presentation, which I will come to. We have to ask, when it comes to education, who and how, and who is really about addressing the 2 components of education, the intellectual component and the resource component. We as surgeons recognize our responsibility for addressing the intellectual side, but we have some ideological questions with regards to who supplies the resources. And the resources are what it's all about in my mind, particularly in light of the restrictive publications and guidelines that have been established in the last 12 or 24 months. How is more about where. Where will the resources come from? Who is the major beneficiary to educating surgeons? Certainly the patients, but there is another element. When the Hippocratic Oath was articulated, 5000 BC, and contrary to what some of the people here have said, I wasn't there. Education, which is the core of the Hippocratic Oath, was verbal. Now it's, and at that time, the modification of the oath indicated that it was without fee or covenant. Life is far more complicated, and when it's necessary for master surgeons, educators to travel far distances, live in hotels, be away from their ordinary responsibilities, there is an aspect to that Hippocrates hadn't considered. One point that I'd like to make is that in the IFSES experience, we made one realization, that from a practical standpoint, it made more sense to deliver the students to the educators rather than have the educators travel great distances with a team of support personnel and equipment. But having said that, let me suggest that we stay mindful of the need to keep idealism subservient to reality. And in this day and age, resources are the true reality. So I would suggest, as the most important and the critical next step, that we attempt to articulate a strong educational policy statement that can be recognized and respected by all quarters, and we should aim that document at the restrictive conflict of interest guidelines that exist with the idea of trumping them. So my message is simply this, if I may offer this suggestion. International Surgical Societies as a group, IFSES, should convene a partnership of dedicated surgeon educators and industry leaders for the purpose of developing and publishing a document, a policy statement, which defines the shared educational responsibilities of these partners. The key word is the partnership, and if we have input from international educators as well as the corporate sector, there should be no objection. The intellectual component should fall to the purview of the surgeons, and the resources and wherewithal component should fall to the purview of industry according to guidelines articulated by this partnership. I hope that within the next 12 or 24 months we see some action, and that we'll move forward in solving this riddle. Thank you very much.
Thank you, Dr. Marx.